Okay, so as the year 2025 is ending, me and Abhi were reflecting on the ESBICM things for the last 1 year, what we have done, what we could have done, what worked, what didn't work. So we thought of discussing this with you all also and our plans for 2026. So I think we'll have tea there. So we'll discuss there over a cup of tea. So we have ordered the tea and now we have jotted down certain points which we are reflecting sitting in the hospital. So by the time the tea comes, let's discuss how this year went for ESBICM, Educational Society of Bedside Intensive Care Medicine, how our ICU channel worked and what were the projects we wanted to do, we couldn't do, and what are our plans for the coming year. So reflecting on that, the first thing which came in our mind is the AI. I think 2025 was the year of AI, where AI models evolved so much, and not only in other branches like radiology, they also came into learning medicine sort of thing. What I mean from learning now, whenever somebody has a query or question in their mind, they don't Google. They just have their different apps. Like some have ChatGPT, some had Gemini, some have Copilot, and other different sort of. And when they ask the questions there, mostly it gives you a refined search. It's better in giving you refined results. It's better in giving you consolidated summaries. In fact, what I was thinking that it also gives you the summary of the different literature at times, which are in public domain. So for giving summaries, giving the latest literature, synthesizing the information, at times giving the answers to a question, it's a very good tool. But we are working in intensive care unit and intensive care medicine. There were many areas where I feel there is a gap, where still the humans and human intelligence, I would say human wisdom is required. AI will not fill that gap. So what I could understand over the last 1 year, that AI gives you the data, but sorry for the interruption, one call from ICU came. So what I was telling, that AI can give you data interpretation, means this is the data theoretically and how it can summarize it, but to apply that data at the patient bedside in the clinical context, still it lacks. Like it will give you a definition of hypotension is having in a patient, you have a 90-60 bp or 80-60 bp, but that blood pressure is different if you are dealing with an onco patient, if you are dealing with a fluid resuscitation of patient, a trauma patient, or adrenaline insufficiency patient, or a patient with a low cardiac output state. So that interpretation differs. Secondly, there are many clinical signs which you need to pick at the patient bedside, like blankening of the fingers when your patient is a vasopressor. That even the saturation is 99, but you need to look at the respiratory rate. Even if the respiratory is okay, if the patient is dyspneic, you need to auscultate the chest whether the patient is having bronchi or not. Then we have been trained to look, listen, and feel. By looking at the patient, you get an idea whether the patient is sick or patient is in discomfort. There are many clinical signs, and the trend of the data. Maybe a urine output of 200, 250 when you give a patient diuretic or patient giving mannitol would be okay. But that urine output in a patient with a pituitary surgery, you will be you will be thinking of DI. You will be concerning whether you will look for the sodium. So there are a lot of things which are going. No doubt, when you think of post pituitary surgery, what are the complications in AI, you will get the theoretical. But on the patient bedside in the intensive care, there is a minute to minute variation, there is a hourly changes which you need to pick at the patient bedside, the clinical sign, the symptoms, the interpretation of data, the context in particular. This is where I think AI has not reached. Still, human wisdom and the people, those who are taking care of the patient, this is there, and still it will continue. I recently posted a poll on the ICU channel that you can get most of the questions. You can just type in the AI, you get answers to the some of the questions. Then why you want to visit the ICU channel? So the most of the you have answered that we want to learn from the experience to get the simplified things, the practical knowledge, and the patient bedside how to apply. These are the things. So I think that makes sense. Still in the intensive care, it's the vigilance on the patient bedside which is required. Obviously, AI can help you in summarizing the thing, in learning concepts a little better, in interpretation of certain things where you get confused. It can give you answers based on your understanding. Like that day we had posted a fire extinguisher video. Now what we were discussing with the AI, that what is the difference between a CO2 fire extinguisher in the ICU and the newer molecule extinguisher in the ICU. So what we got the answer, that there is a molecular difference. One displaces oxygen, the other doesn't displace the oxygen. One generates a very cold environment, one doesn't creates a cold environment, sort of things. And the fire extinguisher person who was carrying the cylinder, whose job was to carry the cylinder, he also, while listening to us, entered the same question in the his mobile. And what the answer he get, that the CO2 cylinder is a little heavier, the newer molecule one is a little lighter. This is a shelf life of 5 years. This is shelf life of this, like this. So you got my point. The AI model understand your skill set and how to modify the knowledge or the answer as per your requirement. So it depends on how you use these tools. So AI is good. It's good for summarizing things, good for understanding things, good for learning the concept. But eventually, what you need to apply at the patient bedside, there the human wisdom always prevails, always has an edge. And I think that is the area where we should keep focusing on touching the patient, auscultating the patient, spending time with the patient bedside. These are the things I think it will help. Now coming to one another point, which I want you all to answer me in the comments. I thought I would say in the end, but I think this is the time where I would ask that. Uh, Most of the societies, when you take memberships of the any societies, like for XYZ society, you take the membership. So what benefits you get? So the one thing you think of, okay, I'll get discounts on the workshops. I will be eligible to certain literature which the society publishes, or some
Discounts on the certificate programs.
on discounts on the certificate program. That's all. Most of the societies give this sort of benefits, or you expect this sort of benefit. So our tea has come. Thank you, Ram. But what I want to ask you all that is that the only thing which is required when you apply for a membership of a certain society. So practically, I want you all to tell me in the comments, and please share with your friends also, colleagues also. As an ESBICM member, what all things you expect from ESBICM? That once you are a member, what you will get? Whether you want to get more live classes, whether you want to get the latest update on the guidelines, whether you want workshops invitation, whether you want conference sort of thing, which we are not organizing as of now. So what are your expectations that becoming an ESBICM member, this benefit we will get? So we want this from you. So please post in the comments so that we can think of it and apply in near future. Now let's come to the things which we are seriously thinking, that what are the things which we failed, or I would not say failed, which tried and did work down to up to that extent which we are thinking of. So the first thing which didn't work out is a academic volunteer program. So in academic volunteer program, you all know that we asked for the volunteership of the ESBIS members, and I think we have one very good volunteer. But we got the entries, but we were lacking the clarity on what they want to do in their institutions because by becoming the ESBIC members, what they want the benefit from us, and also we were lacking the clarity how to shape them, how to help them out, because we were not getting queries how academic volunteer can help their peer group locally. So this is thing which I think we didn't get. Then Telegram and WhatsApp channels are there. We started with Telegram channel. We have more than 10-12,000 members on that. But the problem with that is once you ask a question in it, and somebody keeps on replying, other people are, it gets cluttered and the discussion gets lost, because we wanted to have two-way discussion. In WhatsApp group there is a limitation. The same thing happened in WhatsApp channel when we provided, it's always a one-way communication. So that didn't work out like that. Even on the ESBICM forums, though it is better than the groups, but still the reply time we wanted within 24 hours, but at times it takes weeks to get reply because we are busy in certain other things. So we were not able to reply promptly on the ESBICM forum, though we try to answer each and every question, but I don't think that worked the way we wanted. Secondly, the app which we developed, the ESBICM app, it's a good app because it solves some of the problem. I'll come to that. But still, it doesn't have a feature of notification. Means if something new comes in the app, you should get a notification, like you gave to a notification. So we didn't get that. So our team is working on that. So maybe this year you will get a modified version of the app, which will be also available on the iOS also, not on the Android, but iOS or that. Coming into the same category, email updates. Email updates, actually most of them gets into the spam, and also shooting so much emails to almost lakhs of members which we have. It's very costly affair. It's very costly affair. So that's a challenge to us, which and because we do everything for free of cost, most of the things, 95% things, it drains about a lot of resources. So email communication we didn't work. Google Groups is an alternative which we are figuring out. So these are the things I think which we didn't work, and we need to work on that. How we will be able to do that, we will think on it. But there are many things on which we work, which we were able to do unexpectedly. So first thing is we released our first ebook, which is recent and landmark trials in critical care. Obviously, we took the help of a little bit to compile the data in a faster pace with the AI, but a lot of effort had gone, and by that book is really a boon for those who want to learn the recent trials and landmark trials, read those trials in critical care. Also, we have developed the search engine on the ESBICM website, which is a fantastic tool. You can go to there, search regarding any keyword and trial, and you can get into it. You can read about any trial, even if you are a beginner or an expert. It has the both the values. Secondly, one more thing which I think we are very happy, glad to share. You people also know that because of our work which we are doing for last 7 years, myself, Dr. Ankur, was elected as a national representative of India in European Society of Intensive Care Medicine for 2 years. So it was a huge moment. Now we will be representing India at the global level, and the next 2 years we'll be working in collaboration with the European Society, so we can bring their and we'll share our efficiency, how efficient we are. So this is something which was very proud moment for all of us, and thanks to all of you. Then regarding the app which I told you, though the app doesn't have a notification, uh, कुछ नहीं कुछ. So the app doesn't have notification, but it has automated the process of membership. So earlier there were very long waiting time, but if you because some of the documents needs a little bit clarification. Otherwise, most of the memberships are automated, and they get within 72 hours or within 1 week they get uh, approval. Usually it was 3-4 weeks. So app is working fine. Now, having said that, these were the things, and we crossed almost 50 million views combined on Instagram and the YouTube. ICU channel crossed 5 lakh subscribers combined on Instagram and YouTube. This is itself in a niche purely of intensive care. This was a big achievement to all of us. Now, what all things? So these are the things. Some of them which we work, some of them we do. Now, what are our plans for next year? So some of the plans are what we want that now, because we have covered many basic level almost. Just now before shooting this video, I think we covered almost ICU shot 500 ICU shot we have posted along with the other videos. So we have covered many basic topics. Now it's time to take the to next level. So the first thing which I want is, again going to the basic, I want to teach you applied physiology or physiology in intensive care. What we do in intensive care, we treat the disease, everything we treat, but we forget the physiology. It's time we need to, because ultimately we are normalizing the physiology in intensive care. So therefore we want to learn or revise physiology in that manner. So this is one thing which I want to do. Secondly, I want to, or we together as a team want you to have a program where we teach you how to read and analyze or critical review in research papers, so that you yourself are able to understand that how much value this paper contains. You will not get overwhelmed by seeing a paper. So a course on how to read medical papers, sort of thing, which are coming. Already we are running a course, mechanical ventilation pilot project, a little bit slower than our expected pace because of the all some unavoidable circumstances, but it is doing good. The next batch will be announced soon, and its mechanical ventilation course is doing good. On the same pattern, one we wanted to bring you a medical research paper course, and the other one which we wanted is an antimicrobial course, because infections is something which we need to understand better. We need to look at the MIC level, break points, understand antibiotics, antifungals, antivirals. So we need to have a logical thinking or rational use of antibiotics, antimicrobials. In fact, the government also recently raised the concern regarding the antibiotic resistance. So I think that one course we will be doing next year, coming year. A short course on drugs in intensive care also needs to be done. We know the use case scenario of the drugs, but we forget the interaction and the side effect of the drugs. This is something which we need to do. How to adjust the drugs on the renal dosing, liver dosing, CRRT, RRT, like that we'll cover. So mechanical ventilation, antimicrobials, how to read a research medical paper, and drugs. These are our focus areas which we'll cover this year. Then what we want is more in-depth lectures. Now we have covered basic. Now we want to get deep dive in the lecture, so you will get more longer lectures of 20-30 minutes on the channel. I don't want to do it in the PPT format. Maybe sitting and discussion in a vlog light format or some other format will define, but we don't won't want to be a boring thing. We want to be a casual discussion between you and us, so that the concept get deep rooted. Whenever you have a topic in the mind, you won't get confused. So deep type lectures is something which you want. More live streams for a Q&A. Right now we answer a question while making a video to you or replying to your comments, but we are thinking that once in a month or twice in a month we'll organize a live Q&A session, so that we can answer whatever questions you are asking in the comments live. So if you have some doubt, you can ask during that session. I think this is something we will do. Thirdly, we are trying to develop a. I'm not sure how we will develop. Our web developer team is thinking. We want a two-way communication. Means you want you people also to get listened. We want to interact with you all people. I'm not sure how we'll do it, because Zoom has a limitation, Google Meet has a limitation, because we have lakhs of subscribers, and giving access to only 100 will not be a good idea. So our team is working on that. You will get thing. So these are the things. Before closing, we are also planning to have physical workshops this year. We don't have funds for that as of now, to be very frank, because we don't charge. But if we contribute together and with a small group of people or some group of people, we don't want any sponsorship, because we don't want to be biased in the content. We don't want to get pressurized in the content or promotion or sort of thing. We do not endorse anything. This is our policy for the years. So with a small contribution, if we can make it a sustainable thing, soon we will be organizing a workshop physically where we can interact with you all and have case discussions also thing. So these are a few things which we are discussing, me and Abhi. Abhi is a member of the academic committee of ESBICM. He has been taking care of the membership things. So these are the things which were in the mind. If you have any other thought process or any other thing which you want to share with us, you want to contribute to ESBICM, or you want how ESBICM should do it for you, how we can make things better together, do let me know in the comments. Do share video with your colleagues, whether it's a doctor, nurse, paramedics, or any healthcare professional who is working in intensive care. I think please share with that, so that we can also hear what they want. Wishing you all a very happy and prosperous new year, and I think together we learn, we improve, and uplift the level of critical care medicine together, which will be affordable, free of cost, and sustainable. Thank you. Best wishes from me, Abhi, and
Happy New
everybody
Year.
in ESBICM team.
Happy learning.
We forgot to tell one thing AI cannot do. which we got to understand that there was a difficult case and there was a difference of opinion in between the consultants and the intervention team. And after a lot of discussion of 4-5 hours, and then with the family, the issue is solved, and now we are heading for the procedure. So AI cannot solve the dilemmas in a real case scenario. There, you have two sort of intervention, or 2 or 3 options are there: understanding the patient's will, ethical issues, coordinating with the consulting team, coordinating with the intervention team. So this is something which also AI cannot do in intensive care, which is very demanding. So these are the ethical issues, I think, where human wisdom always excels. Opening in front of you all, batch. So you can come and see. And again, now, tata, bye bye.